Whether we admit it or not, Hollywood has given sex such a glorified and almost always unreal perfection to it, thereby making us completely dysfunctional in more ways than one. But problems really do happen that can crush a couple's self-esteem. In this episode of Dynamic Living, The Total You, we will look into the factors that could affect sexual satisfaction in a man in real life. I am very much honored tonight to have with me here a practicing urologist. He's a friend of mine. I'd like to welcome Dr. Greg Cordovez. Welcome to the show, Greg.
Thank you, Jean. Thank you for having me here.
Oo, kasi medyo ang topic natin is something that is actually very relevant to the totality of a person's life, no? And especially among men. So we'll start off siguro before we start talking about the dark secrets behind closed doors. Siyempre, meron mga secrets yan behind those locked doors. We'd like to start off by asking you na, what are the common problems that men really face, which is actually your specialty?
Okay. So let me start with, it would depend on the age group of the male. So for males from 30 to 40s, usually it's more of infections, prostate, because most of the problems are with regards to the prostate. So most likely at this age group, prostatitis is the main problem.
And usually, Greg, pagka sinabi mong 30 to 40 years of age and prostatitis, usually what do they feel? Bakit mo, and would they seek consultation immediately or hindi kagad?
Okay, usually the symptoms would refer to the urinary tract. So at times there may be frequency, sigig-sigig pangi, you know. At times there may be difficulty in urination. At times there may be pain in urination. Sometimes the patient would also complain of low back pain, like hypogastric discomfort.
Parang it's almost, similar to a woman urinary tract infection.
Yes,
yung sa babae, di ba? So napo din sa lalaki yung
Yeah,
may nana,
yeah.
and it's also common.
Yes.
And then next, after that, kung after the 40 years of age, unsa naman po yung next ng ilang problem, ani?
Usually when the male reaches 40 and onwards, then BPH or the benign prostatic hyperplasia starts to set in. Usually, nag-start of 40, magsugod na nagdako ang prostate. But the patient or the male may not feel it yet. So, wala pa sila yung simptomas. Sila.
So, they don't seek consultation?
Yes.
Parang unlike kasi in women, kunyari, if it's the breast, they have problems, nada sila makita So, they would immediately seek consultation.
Yes.
Pero sa prostate hyperplasia, when the prostate gland enlarges, wala dahil na sila mabati?
Wala pa. Later part, then they would start to manifest with urinary tract symptoms like kaning ihi-ihi sa gabi, frequency at night, we call that nocturia, more than twice in the evening. And then naasay gitawag og hesitancy once they start to pee, napay delay pipila ka seconds before they would start to void. And then napay intermittency, once the urine starts to flow, then it stops, then it flows again. Then weak ang ilang stream, weak ang pressure, then after urinating, they feel like something is still left inside, like inadequate emptying.
Wala na siya ginapili in terms of, di ba, like, for example, among Filipino men, is that something common among our colleagues na mga lalaki sa Pinas, or is it something na mas common pa na siya sa Caucasians or sa mga urbanized areas? Kani siya, does it seek any,
Wala siya predisposition. Wala, as the male ages, the more chances he will be having this disease, BPH.
It's not something na namamana siya?
Unlikely, sad. Okay? It's usually this hormonal thing.
Okay.
Once we reach this certain age, there's something like a switch. Turn on na siya, hormonal stimulation, then boom, so good na nagdako ang prostate.
So when they come see you for a checkup, kasi they have, as you mentioned, kato kaganina sa ilang mabatian, what do you do in order for you to ascertain na kanimo gyud ni iyang problem?
Okay. So first and foremost would be history, ang iyang voiding patterns. We have actually a kanang validified questionnaire for that. No? It's standard. It's globally accepted for that. Then we can we can grade the severity of the symptoms. We call that LUTS, or lower urinary tract symptoms. We can grade it according to severity. Then after that, we can do a physical examination finding, like a rectal examination.
Would you say nga ang digital rectal examination is a must at a certain age group for men?
Yes, actually, we would advise that for males with no prostate cancer family history, we would advise that they have a annual checkup, DRE, or digital rectal examination, once a year. But if the male has a strong family history, say for example his dad, his siblings had prostate cancer, then they have to start earlier, at the age 40, for evaluation, screening.
You mentioned something na you have a scoring for you to be able to grade ang hypertrophy or hyperplasia of the prostate gland.
Yeah.
Would you say na ang imuhang management will also depend on the scoring here?
Yes, yes. We call this the International Prostate Symptom Score. So we would divide the category into mild, intermediate, and the most bothersome. Okay. So if it's mild, some patients can undergo watchful waiting or change in dietary factors or other health habits. But if it's moderate, then we can start giving medical treatment, pharmacologic treatment, medications. If it's severe and there's complications attendant to it, then we can advise surgery, surgical intervention.
Pero pagka mga ganyan, Greg, you always give them the options naman, no? What they can do, or or what I mean, kahit na severe siya, the patient, if they would opt not to be operated on, pero you explain to them kung what will happen.
It would depend if the patient already has this, what we call absolute indications for surgical intervention, like for one, like renal deterioration, there is compromise of the kidneys because of the chronic obstruction, then the patient has to undergo intervention. If the patient has recurrent or persistent infection, UTI, then the patient has to undergo intervention. If the patient has develops bladder stones from the chronic obstruction, then he has to undergo.
So naagyo the indication for this.
Yes,
And
yes.
so you go now to the other end. Syempre, that's benign. And you mentioned something like prostatic cancer, we know for a fact, is one of the leading causes that affects males, di ba? Sa mga kalalakihan. Kung sa babae, it's breast cancer. Sa mga lalaki, it's more of sa prostate naman. So who are the candidates na who are likely to develop prostate cancer?
Okay. So these are for males. This is where genetics comes into play. Like for males with a family history, then they may be prone. They may be high risk for developing also prostate cancer.
How old nga pala sila, Greg, usually will develop this? Bata pa ba? Or they go, as they age, parang mas ano siya?
Actually, it's also like BPH. The older you get, the more chances of you having this disease. But I have seen patients, my youngest patient was 42 years old. He had prostate cancer.
Bata, no? They're getting younger yata eh. So when aside from genetics, what would account? Like some people would say, syempre there's a misconception na yung mga married men who are usually using it daw, they have a tendency not to have it, di ba? Parang sometimes they would even say na prostatic massage para hindi daw. So aside pa dun sa genetic na yan, would you say na it's more of a hormonal thing also? Kaya sila nagde-develop?
Yeah, actually. Aside from the genetic also is the dietary.
Okay.
Let me just mention this. Because Westerners are more prone to prostate cancer compared to Asians. But when these Asians, they migrate to Western areas and they assimilate the culture and they become Westernized, then they have higher incidences of prostate cancer.
Why? What's in the diet? I mean, is it more of a high-fat, high-cholesterol diet?
Yes, more of the animal protein fat.
And this is already proven in studies, di ba? Kasi dati-rati, in our textbooks, when we were students, way back years ago, hindi naman sinali ang diet as part of the risk factor for one to have a prostate cancer. So, are the symptoms also similar to that of a prostate hyperplasia for prostate cancer?
Yes, more or less they do have the same symptoms, referring to the lower urinary tract, unless if it's a far advanced prostate cancer, when the patient would start to manifest with bone pains because the predisposition of prostate cancer is to spread through the bones.
So when you say na they develop bone pains, is it parang terminal na gyud kaayo when they come and see you? Kasi sabi mo na it's something na, just like prostate hyperplasia, it's something na dili bitaw dayon mo manifest.
Yes.
They don't feel, or maybe if they feel something, you know, men are the type who do not go seek consultation immediately. Unlike
That's true.
women, ang mga kababayan, sakit lang ng ulo, hay nako, magpapacheck up na ako.
That's true.
Masakit lang yan, magpapacheck up na. But men, you know, they have a tendency to just take it, you know, para bang in stride na, wala lang yun.
That's true, that's true. Bone pains, that would be stage 4 already, because it has already spread to the bones. But prostate cancer is not like the other cancer. It's really quite fast, no? Some patients with stage 4, even with bone mets, can go as... some patients would go to live as long as 4 years or
From the
5
time
years.
na diagnose siya.
Yes.
So that
As
is
long
with
as-
treatment.
Yes, with treatment. Treatment given.
So usually when they come see you, do they come for consultation earlier on or hindi talaga? They just come in because of something else?
Okay. We have this activity with the Philippine Urological Association. We try to educate the males that when they reach 50, they should go and seek for prostate cancer screening. So this has helped because some patients, when they read this, they go to our clinic even if they are without symptoms and have a prostate cancer screening. Some patients also, they come in because of symptoms already, referable to voiding, difficulty in voiding.
In your practice, you've been in the practice for quite some time already. Would you say that there is a rising number or cases of prostate cancer these days compared to, say, 10 or 20 years ago?
Yes, because the PSA, if the audience have heard about this, it's a screening tool for prostate cancer. It has been available in worldwide since the late 80s and the Philippines early 90s. And we have picked up a lot of cancers because of this screening tool compared to before the advent of this. They usually come in with a late stage. But there is a controversy now in the States with regards to the use of PSA.
Which we will discuss when we
Yes.
return. We'll take a
Yes.
very short
Okay.
break. Please stay tuned. And yes, dear viewers, if you have questions, you can phone us or text us in the numbers that are seen or shown in the TV monitors. Please stay tuned.
Sponsored by the World Seventh-day Adventist Church. We believe in being people of the Word, people of prayer, people of deep study of the prophetic writings, people who love Jesus Christ, people who keep all the 10 Commandments, people who are compassionate, who respect others, the community and world needs, people who live healthfully by avoiding tobacco, alcohol, unclean meats, drugs and immorality. We believe in joy. We invite you to be a person of hope. It takes a global network to be in touch with planet Earth's global community. Hope Channel broadcasts everywhere in the world with 10 global channels and is affiliated with more than 50 production studios on 6 continents. Hope Channel provides a diverse cultural programming mix in many of the world's major languages. Hope is more than great television. Welcome to Hope Channel.
Tinuod si Jesus mubalik sa dili madugay. Og 80 milyones ka makatawhan sa tibuok Pilipinas ang kinahanglan masayod niini.
O 80 milyones sulod sa 7,000 kapin ka mga isla? Posible ka kini?
Mauna kini ang panahon nga mag-usa ang katawhan sa Dios.
Aron ni hatod ang mensahe sa kaluwasan sa tanang suok sa nasod sa Pilipinas.
Pinaagi sa imo og sa akong Kristohanong impluensya sa uban.
Inabanan sa gahom sa Dios. Isip usa ka pamilya nga nagadala sa puwersa sa kamatuoran, walay imposible.
Ang Diyos mismo magasiguro nga kining iyang buhat matapos gayod.
Ang Hope Channel Philippines usa sa pinakamaayo nga galimiton sa Dios. Aron ang mensahe sa kaluwasan mahimong mas madali, mahatod ngadto sa mga katawhan.
Pinaagi sa internet,
pinaagi sa radio,
ug labi na gayud pinaagi sa telebisyon.
ang inyong mga pag-ampo.
Inubanan sa inyong mga gasa, magamay man kini kun madako.
Sa kamot sa Dios bililhon kini.
Nga magadala og dakong kausaban sa kinabuhi sa tanan.
Diha sa bulaton sa Dios, ang tanang kalambuan mahimong posible.
Kita nagatuo nga ania kanato ang matuod nga mensahe sa kamatuoran.
Pinaagi sa Hope Channel, mas madaling makabot nato ang kadaugan sa pagmensahe.
Apan ang kalambuan ini nga buhat, nagadepende kanimo og kanako.
Isip nga sakop niining panimalay sa Dios,
nga nagabaton sa kamatuoran nga pinasikat sa balaang kasulatan.
Ikaw ug ako kabahin ini nga buhat.
Kita nga piniling henerasyon, ang salin nga katawhan,
Mga magbubuhat nga ang tumungog tuyo mo ang pagsangyaw sa mayong balita.
Nga ang Dios gugma ug siya mo anhi pag-usap sa dili madugay.
Ang Hope Channel Philippines mo ang modernong pamaagi sa pag-ibanghilyo nining atong moderno nga panahon.
Ayaw jud ninyong sipyata sa pag-apil ni ining balaan nga bululuhaton.
Himua ang imong kaugalingon ug ang imong panimalay nga tipik ni ining talagsaon nga pagministeryo.
Kaming mga magbubuhat sa South Philippine Union Conference, mag-auhag o magapadasig kaninyong tanan nga makaigsuonan nga
usa ka tricycle driver nga mo duty og gabi usahay pod maadlaw. Usahay ra pod akong makuha sa pag-drive na gusikan kada adlaw. Gatos kapin 200 tungod kay dili man gud ko pod mo ilog sa ilag pasayro mo po nang igo-igo ra gid pod ang akong makuha. Nganhi ko diri kay aron sa pagtabang sa Hope Radio sa dayang akong nadunggan, akong gibalhin-balhin ang matag channel kining matag istasyonan sa FM. Ako lang makahibalo lang ko kung unsa po'y kamatuoran bahin sa pag kinabuhi natong malipayon nining kalibutan. Yung anhi ko aron sa paghatag og kinasing-kasing nga donasyon. Pero walay gatudlo na ko niini kun dili ang kinasing-kasing og kini nga gihimo. Ako nalipay ko nga nakahatag ko sa Hope Radio bisan sa kinagamyan lang pod nga kuan matabang ako minghatag ko og 50 pesos lang kada Biyernes o kada semana sa kausasa sa kasemana sigon sa income nga akong maabot. Akong gibati ang usa ka dakong kalibay nga makatabang ako sa buluhaton sa Ginoo nga ang Ginoo makagiya usab siya sa iyang kahibalongan kanako. Dayon ako usab magadawat sa iyang kuan pinaagi sa maayong panimpalad ug pinaagi sa maayong dula sa kinabuhi.
Presenting the all-new Hope Channel. Clearer.
Mga personalidad nga adunay kaikag sa pagbarog sa
kami nga magtiayo. Eksperyensya nga nagpamatuod. Na kung ikaw
Brighter.
I was confused because ginatanaw nato nga wala na tay kakampi. We are in
Stronger. Arresting the attention.
bonus na kung maging positive and it makes you
Deadly in earnest.
Right now, the campers are having their hiking.
Bringing Christ to Mindanao.
ang tubig igsuon importante kayo.
Let's listen to what the nature will speak to us.
And bringing Mindanao to the world.
Dynamic living the totally life impacted.
To feel the touch of His redeeming love.
And the world to come.
Akong right lobe, kumplito na siya.
Sa diyang nagtawag ko,
Yes, Hope Channel Philippines will show you. There's hope in Jesus, and there's more to life.
Welcome back to Dynamic Living, the Total You, with our episode, Dark Secrets Behind Closed Doors. Meron palang mga secrets dyan, no? Sa mga nakasarang pinto. I'd like to welcome to the show. We will be joined tonight by Dr. Olive Pelagio. She's a psychologist. And welcome to the show, Dr. Olive.
Good evening sa atong mga televiewers. Good evening, Doc.
And kanina, Doc Olive, we were discussing with Dr. Greg already about common problems affecting the male population. So, ipadayon lang sa tunako.
Okay.
And so, before we took the break, Greg, we were discussing about the prostate's specific antigen. You mentioned something na there's a controversy going on with this examination. Does it have something to do with the level, the cutoff level that they have? Or is it a matter of hindi na nila masyadong ginagamit sa Western countries ito?
No, actually, it's more of over-treatment. Over-treatment. So there is this agency sa states, United States Preventive Task Force Services. They have admonished that the use of PSA may be actually harmful to the patients, because with this, a lot of prostate cancer patients who do not actually need treatment end up having the treatment, and with the treatment, then they do have this side effects.
Pero when you say na they have prostate cancer and they don't have to be treated, is that what they're saying?
Yes.
So paano yun?
Types of prostate cancer, because as a pathologist, there is this we call the mild, the intermediate, and the aggressive type. Then we usually for easy, what you call understanding to the layman, we call them like the turtle, the mild, then the rabbits or the hare, the intermediate, and the tigers, or the aggressive type. So the turtles or the tortoise, we can do watchful observation, because some of these patients who just outlive their cancer, they may die of some other causes,
but not the cancer.
Not the cancer itself. So the second type would be the hare. These are what we are more interested with, because these are the types of cancer that may cause significant morbidity and mortality to the patients. So these are the patients that we would like to catch and treat. Okay? And the tigers or the dragons, these are the cancers that we could not do anything about.
Anymore.
Yes.
Pero, syempre, the PSA kasi is there to guide them also, di ba?
Yes.
So instead, how often would you request a PSA examination pala?
Yeah, for my practice, I do a annual PSA. For those with a family history, then I start younger at age 40. For those without family history, then we start at age 50.
That's once a year?
Yes, once a year.
It's not every 6 months?
No. Once a year is enough, and then a rectal examination. Because there are some findings in a rectal examination which may give a normal PSA.
Kaya nga. So, merong mga cases din na so, dapat i-correlate mo lahat yun.
Yes, they should work hand in hand.
So, let's go back kanina. I mentioned something like the frequency. Diba? Something to do with, sabi natin na there are people, lay persons out there who think na the frequency of the sexual activity has something to do with the development of either a hypertrophy or of a prostate cancer.
Yes, it may have a relation, yes. In patients who have prostate cancer, they have been noted to have higher testosterone levels compared to their counterpart males. Okay, so these males who have higher testosterone levels do have higher libido. Then they engage more into sexual activities.
And so their chances or risk of developing these problems mas mababa.
No,
Or mas
actually,
mataas?
actually the
Tumatawa si Miss Olive eh. Ha? Miss Olive, kasi syempre, kailangan natin,
misconception.
Yeah.
Oo.
Well, actually,
Okay.
during the first part of this show, we were, just being mild about this eh. Pero this is a reality that we have to face. And, ang mga Pinoy kasi, sa totoo lang, mahiyain talaga yan. Di ba, Miss Olive? Alam mo yun eh. Hindi yan basta-basta nalalabas. Kaya nga, secrets behind closed doors eh. Nakatago lang yan. But, we have to educate them. Kasi somewhere along the line, just like, we always define health as the totality of a person, not being sick. But one part or one aspect of that health is actually the sexual health of an individual, whether it's a male or it's a female. And it also has bearing on their relationships, diba, as couples, diba? So that's why we have to be open about this in a very, let's say, na malinis na paraan, hindi malaswa, di ba? So balikan natin.
Okay.
Yes.
Because most of the layperson would attribute patients having prostate cancer as those who frequently engage in sex. No? But actually, the truth is they have a higher testosterone level, they have higher libidos, so they want more, they have the need for more sex. And it's because of the testosterone that causes prostate cancer in the end.
The high levels, the uncontrolled of your testosterone level. Kasi at a certain age, it really goes down, di ba? Pero dito sa mga certain population na to, whether they age or what, talagang mataas yun.
Yes. There is also what we call this, when there's a dip in the testosterone, but there is still an increase in the prostate cancer evidence. We are still unable to
explain.
To know, yes, why this is so. But the treatment for prostate cancer is still hormonal ablation.
Okay.
Once you cut off the testosterone feeding on the prostate cancer cells, then you can keep the prostate cancer cells at bay.
So, we'll now discuss management. Kasi syempre, doon tayo pupunta ngayon eh. So, paano yung, you said something like ablation. So, sinabi mo, pag ablation yun, tatanggalin yung source nung kung saan napuproduce yung testosterone, right?
Yes. Okay. So, let me start first with, if the patient is diagnosed with prostate cancer, then he has to be staged. So, if there are 4 stages, if the patient is in stage 1 or maybe stage 2, there are still options for cure, like surgery, total removal of the prostate, we call radical prostatectomy, whether open surgery or robotic-assisted prostatectomy or laparoscopic. These are the options for cure. But if it's stage 3 or stage 4 onwards, the more advanced cases, then the treatment would be hormonal, cutting off the hormonal supply to the prostate cancer cells.
So, pag sinabi mo yun, Greg, na ablation, tinanggal mo yung source, then it will have an effect on the libido, or, impotence is one of that.
Yes,
diba?
Yes. But this is more of weighing the benefits over the risk, right? So, if you have an advanced cancer, then you really have to stop the source of the prostatic cancer cell growth. So the ablation would be by 2 means. One would be surgical, that would be orchiectomy and giving some medications for the hormones coming from the adrenals. And another would be medical, by giving LHRH injections to curtail
both either way will actually curb the libido of the individual.
The production of testosterone.
Pero walang problema doon, Miss Olive. Papasok ngayon tayo kay Ma'am Olive. Walang problema doon kasi medical treatment yun. Kailangan yun para lang humaba pa yung buhay niya. Kumbaga, hindi na yun ang pinakamahalaga. Ang pinakamahalaga ay mabuhay siya, di ba? Pero we know also for a fact na without problems like hyperplasia or hypertrophy or prostate cancer, meron talaga yung tinatawag na sexual dysfunction among men, di ba? So pag-usapan lang natin ang mga lalaki muna, sa sunod na yung mga kababaihan naman. Miss Olive, do you think na ang mga lalaki in general sa Philippine setting, we're talking about our mga colleagues, mga kababayan natin, mga Pinoy, talaga bang inherently nahihiya sila na aminin na may problema sila pagdating dyan?
Men are naturally egoistic.
Okay.
Sorry, Doc.
Nagigitnan pa naman natin si Greg.
Nasa gitna. Anyway, egoistic sila and they don't want to talk about it. And aside from that, our culture, of course, yung parang tubo pa din yung mga ganung bagay pag napag-uusapan. So it would be very best na, like example, those na they are undergoing surgery, they should understand both spouses have to, undergo psychoeducation for them to understand ano yung pwedeng kahinatnan right after the surgery, for example.
So yan, Greg, do you also do a holistic counseling to your patient and their spouse, their partner, pagka ganyan?
Before we give the options, the different options available, then we have to ask with regards to this part, whether they are still sexually active. But most of the patients this age would just say na we are no longer into that, so that's not an issue.
Totoo ba yun,
That's
Miss
not an issue.
Olive? Sige nga. Sabihin na natin 40, 50, 60, di ba? Hello? Sige nga, Ma'am Olive.
Kaya ba tinatanong ng ganun? Can you answer immediately? Di ba ba? Kasi tabu siya, di ba? So, most of the time, sasabihin talaga, no, we're no longer on that.
So, nagsisinungaling lang yun. Hindi yung nagsasabi na
Come to
totoo.
think of it, pag dumarating na daw tayo in 40, midlifers, di ba?
Yeah.
At the same time, physiologically, medyo may mga problema na. At the same time, when it comes to sexual, medyo nagde-decline na din because of the testosterone, di ba?
Pero hindi ha. Di ba sabi nila, life begins at 40 for women and life begins at 50 for men.
Yung struggle. Alam mo ba, if you're going to think about it, ang daming nagpapa-annul sa age din na yan. Kasi nga, begins at 40.
Kaya nga.
Kasi ang daming dapat pag-uusapan, papasok diyan talaga yung sexual problem. Kasi meron diyan nagsasabi na actually meron ng mga dysfunctions, hindi na nag-e-erect, something like that, especially for men. So those are things talaga na dapat they have to talk about it, especially the wife. Meron naman tayong tinatawag na sex therapy.
Totoo yan, So, pag sinabi mo ba na sexual dysfunction, what does it mean pala?
Okay. So, sexual dysfunction would mean either erectile dysfunction. That's one
Is
part.
that the most common?
Yes, it's the most common. And there's also this premature ejaculation.
So, pag sinabi mong erectile dysfunction, meron ba siyang certain age group na mas common siya, or it can just happen, even at a very young age, and then namimili ba ito kung educated ka at hindi ka educated, urbanized ka or rural ka, mayaman ka o mahirap pa?
We don't have demographics for Filipinos, but in Western countries, I would say, I have read that in males above 40, 1 out of 50 will have this problem.
Marami yun ha?
Yes,
kung 1 out of 50.
But in males above 65, usually 1 out of 4 will have this problem.
Napakataas na nun. So, Miss Olive, paano yan kung 1 out of 50 daw, pagka 40, pagka 50, 1 out of 4 na?
and not to mention, meron pa tayong mga arousal disorder, di ba? Tapos yung orgasm problems, mga ganon, which would later on talagang develop to sexual dysfunctions, lahat-lahat. So, yun nga, sex therapy could be one of the options.
Do you get to see mga clients coming to your clinic asking for kumbaga nagbubuhos lang ng mga nila, lalo na yung either ang babae o kaya ang lalaki. Usually kasi ang babae mas maboka di ba? So nagkukwento yan si Mrs. doon sa mga kapitbahay niya o kaya sa mga kaibigan niya na ganito, ganyan. Mas hindi mahihain ang babae, di ba? So do you get to see males coming to you?
Mostly actually when I do psychoeducation, that is conducting trainings, especially on gender and development, papasok kasi doon especially yung menopausal tsaka andropausal na mga issues. Mostly doon sila nagtatanong, ang dami nagre-react. Pero when you're going to ask kung sa clinic ba talaga, iilan lang talaga yung yung talagang they have accepted na meron silang problema na ganun. Pero later on during the marriage counseling naman, we have to explore those things also. Kasi there are times na yun din talaga yung problema, na hindi lang siya napag-uusapan.
Alam mo, Miss Olive, you are right. Greg, alam mo, last week we had our episode here about, affairs of the heart, no? And one of our marriage counselors, si Elder Serrano, brought up na there are 4 reasons bakit nagkakaproblema ang mag-asawa, ang couples. And actually, one of that is actually their sexual relationship. And this has to be addressed. Otherwise, it can, it can eat up on a relationship. So, puntahan natin ngayon yung So, what could give rise to this mga erectile dysfunction na yan? Let's start with erectile dysfunction. Kasi yan ang being pinaka-common. What would cause this?
Okay. Just like cardiovascular diseases, this also has a lot of comorbidities like diabetes, hypertension, dyslipidemia, and such. No, so if you have a young patient with ED, you probably have to delve further because he may have other cardiovascular problems later on. So aside from this one...
so pag sinabi mong cardiovascular, pag sinabi mo, kunyari mataas ang cholesterol level niya.
Yes.
So ibig sabihin, meron din siyang high blood pressure. Kasama na din doon.
Yes.
So sinabi mo rin kanina na dyslipidemia at saka yung diabetes.
Yeah.
So all of this all boils down to the circulation, the blood
Yes,
circulation
yes.
of the individual.
Yes, because the penis is a very vascular organ. Once you're sexually stimulated, then there is this influx of blood into these vacuums, and then you have a erection.
Okay.
So if there's a problem with the supply of blood here, then
Would you say alcoholism and smoking can also have something to do with it?
Yes, smoking, yes, that it does. Alcohol is a downer also, right?
What about yung mga sinasabi nilang mga occupational hazards, like yung mga drivers daw? Kasi sobrang nakaupo lang at mainit masyado yung makina. Would you say na heto will also produce ED?
Especially in cyclists, those who undergo long-distance cycling, this may injure the perineal nerves, the perineum, and causes a neurologic type of ED.
Okay. So, paano yun? So, kapag ganyan ang problem, it can be treated medically or hindi naman?
If it's still reversible, no, then you can address the change in lifestyle, health habits, then it can be addressed.
Pero there are also certain instances, Ma'am Olive, na kung baga, yung sinabi ni Dr. more of sa organic yun diba? So, yun yung mga problema, kaya nagkakaroon siya ng problem doon. Pero paano yung stress? Can it affect? Or maybe, kung ayaw mo na yung asawa mo.
Okay, ito yon. Stress, anxiety, depression.
Okay.
Yun, those are stuff na talagang highly correlated with those sexual dysfunctions. And also, the side effects of the medication, especially sa mga cardiovascular patients.
Can also
yung mga LOL.
Di po ba, Doc? Beta blockers, diuretics.
And these are things na dapat din na malaman ng patients tapos nung asawa. Kaya nga po, we advise these patients these clients coming to us who have this kind of problem to really consult their doctors once in a while if they have experienced such. Para naman po, they could change, for example, the medications that they have depending on the needs. Because first and foremost naman, if they come to me, assessment muna po yon. So I have to check kung meron bang mga medications like that. And then,
kung minus all of this, kung sinabi na natin na healthy naman talaga siya, wala naman siya noon. And yet, the individual experiences erectile dysfunction. So what would be your line of here?
Kasi sinabi natin kanina, one of which is stress, tsaka yung anxiety and depression. And also, yung those who are undergoing trauma in sexual activity before. Or could be, Opo, example, yung mga, they are caught in the act of making love tapos hindi spouse nila. Things like that. Kasi yung guilt feeling, psychologically.
Ay, pero hindi lahat nagkakaroon ng guilt feelings, ha?
Oo, pero pag traumatic yung experience, definitely, it will affect.
Okay, please stay tuned. We'll return after a short break.
Okay, cool.
Usa ka tricycle driver nga mo duty og gabi usahay pod maadlaw. Usahay mo akong makuha sa pag-drive na kusikan kada adlaw. Gatos ka pin 200 tungod kay dili man gud ko pud mo ilog sa ilag pasayro mo po nang igo-igo ra gid pud ang akong makuha. Nganhi ko diri kay aron sa pagtabang sa Hope Radio sa dayang akong nadunggan, akong gibalhin-balhin ang matag channel kining matag istasyonan sa FM. Ang ako lang, makahibalo lang ko kung unsa po'y kamatuoran bahin sa pag kinabuhi na itong malipayon nining kalibutan na. Yung anhi ko aron sa hatag og kinasing-kasing nga donasyon. Pero walay katudlo na kun ini kun dili ang kinasing-kasing og kini nga gihimo. Ako nalipay ko nga nakahatag ko sa operadyo bisan sa kinagamyan lang pud nga kuan tabang. Ako hatag ko og 50 pesos lang kada Biyernes o kada semana sa kausa sa kasemana sigon sa income nga akong maabot. Akong gibati ang usa ka dakong kalibay nga makatabang ako sa buluhaton sa Ginoo nga ang Ginoo makagiya usab siya sa iyang kahibalongan kanako. Dayon ako usab magadawat sa iyang kuan pinaagi sa maayong panimpalad ug pinaagi sa maayong dula sa kinabuhi.
Welcome back to Dynamic Living the Total You with our episode Dark Secrets Behind Closed Doors. So napakasaya po na aming kwentuhan dito ni Dr. Olive, ni Dr. Greg. So you may want to ask your question so you can just text or call our lines, no? So balikan nato yun kanina before we took a break. We mentioned something like, yes, Ma'am Olive.
Yun nga, yung mga traumatic events, especially referring to sexual activities. Oo. And then, isang good po siguro nga makatabang is that husband and wife courtship should not end in marriage. Para before lugar the sexual activity, or we call that lovemaking, at least hindi nawawala yung, you know, yung panggigigil sa isa't isa. Things like that.
So dapat medyo romantic pa rin ang dating. Kasi part yan di ba? Sa inyong counseling sa kanila. Lalo na sa mga kababaihan, kailangan mabango, malinis para pag uwi ni mister, gustong-gusto pa rin, imbis na pumunta sa kapitbahay. So, balikan natin, Greg. So, would you say na the Filipinos na siguro most of your patients are Filipinos, ka nandito man tayo sa Pinas. Would you say na mas expressive ba sila pagdating sa bagay na to in asking your, you know, your guidance or the, you know, when they seek consultation, or medyo nahihiya din silang sabihin yan sa'yo?
Usually they are quite embarrassed to ask this. At times, if the couple comes in for a checkup, the wife usually is the one who is more vocal and asks the doctor with regards to this problem, while the husband just keeps quiet.
So, ibig sabihin talaga ang mga kababaihan, hindi marunong mahiya, Dr. Olive.
Kasi naman, most of the time, itong mga babae, they wanted to make things happen. Like, sila yung talagang nag-i-initiate para kung meron mang dapat i-sort out, then they are going to do that. Kasi mostly naman sa mga lalaki, they're not verbal talaga, di ba? They just keep quiet, pero meron na palang problema, no? Tulad ng sinabi mo, Doc, na ito yung uno yung mga complaints, pero later on, it redounds to sexual problems.
So, would you say also na hindi lang mga lalaki ang may problem nito, pati mga babae, di ba? Meron ding mga sexual dysfunction sa mga babae.
Of course, especially pag nasa menopausal stage sila, di po ba, Doc?
Do you get to have husbands expressing them also to you, Greg, na etong asawa ko may problema, Doc, tulungan niyo kami?
Usually, I would refer them to the OB.
So, ayaw mo na ikaw.
So, I would tell the husband that this is not a license to have an affair. Because your wife has a problem, you go to an OB.
Oo, kasi baka mamaya gawin nilang license yan, di ba? Kung baga, that is now their permission to go seek somebody else, di ba? Dapat hindi kasi ang target nga natin to strengthen their relationship as couples, di ba? So, pag sinabi natin, puntahan mo natin yung premature ejaculation, sinabi mo, are there certain ways by which they will be able to prevent this, or do they have to take medications or so that they can correct this?
Okay. So, the only thing we can give is medications. And there are actually no FDA-approved medications for this, but just the off-label use. Mga SSRIs, like what we have here is sertraline, Zoloft, It's an antidepressant.
Paano yung Greg? Marami kasi, Dr. Olive, na mga yung mga herbal, na mga, alam mo, maraming mga sinasabing, of course, no therapeutic claims, and yet, ang kanilang advertisement is it will increase. So, how would you, with patients coming to you on
we would not recommend that because we actually don't know what the ingredients are, and they may have a what we call a fatal effect with other drugs that he is concomitantly taking.
So, for erectile dysfunction, alam naman natin talaga, napaka known ito at saka everybody knows about this na they can be given certain medications that will improve the blood flow.
It's the first line of treatment, giving we call it the PDE5, phosphodiesterase 5 inhibitors, like we have sildenafil, we have tadalafil, we have vardenafil. These are the three PDE5s. After taking this, the patient does not have a erection right away. He has to have stimulation. So with the stimulation, then there is this release of these nitric oxides, then which causes the process of
which will
erection.
improve. Pero
Yes.
does it have to be prescribed? Kasi
Yes,
syempre,
yes.
baka over the counter, kahit sino-sino na lang.
It should be it's a prescription drug because it's not supposed to be taken with other drugs because it may prove fatal.
Kaya ko tinanong yan, Dr. Olive, alam mo kung bakit, Greg? Kasi syempre, si kapitbahay meron noon makikihingi na lang, di ba? So, pagkatapos naging fatal pa pala.
That's dangerous.
Kasi
That's dangerous.
ugali natin mga Pinoy, kung ano yung iniinom nung kabila, gusto din natin yun. Yes.
Because some of these patients, especially the elderly naman, they may be taking some cardiovascular drugs, anti-anginal drugs. So once you take these anti-anginal drugs and this PDE5, then you may have a really precipitous drop in blood pressure, which may be actually fatal.
So dapat ingat kayo mga kalalakihan, wag kahit ano lang. So let's answer questions from our viewers. From Mr. De La Cruz, good evening po. Wala ba free screening for prostate?
Okay, we have this annual activity by the Philippine Urological Association. It's nationwide. We call it DRE or PADRE. It's usually during the Father's Day, third week of June. It's a Saturday usually. It's done nationwide. In Cagayan de Oro, we usually do it in Northern Mindanao Medical Center. It's a whole Saturday affair. We do screening for prostate cancer.
So kasama doon.
Free, yes.
So next question dito. Anonymous, tinuod ba nga ang tambal daw sa sira ay butong? Ibig sabihin water. Unsa man ang scientific explanation aning sira? They call sira erectile dysfunction.
No, I think it's a different.
Different?
I think they're referring to STD here.
Okay.
Or STI.
STI,
okay. So ano nito? Pwede daw ba magtambalan ng butong?
No, actually, it's STD is caused by a bacteria. So it has to be treated with antibiotics, antibacterial. Ang butong may just alleviate the symptoms since diuresis man, ihi, no? So mas lesser ang pain, but the infection will still be there if it's untreated.
And then problem yan pag untreated ito, it can affect other organs of your system. And you can die from this kasi magka-sepsis ka. From another caller, tinood ba nga ang pagtambok sa lalaki makawala sa iyang strep? Sa sexuality, mag-matter ba ang ability adtong anang sexual contact?
Okay. We call this in medical term metabolic syndrome for males nga dagko na ang belly, no? Dagko ng belly, they easily get fatigue, dali rin makapoy, loss of libido, na siya. This is also coincides with the drop in testosterone level. So sometimes some of these males seek consultation for probable testosterone replacement. So as long as the patient does not have any focal or localized prostate cancer, then you can safely give this
follow-up question niya ang pag-inom ba pag-inom, alcoholism daw ba can also cause decrease in libido?
Downers.
Okay, so ayaw inom.
Downers. So, kay misconception na siya daw. Kaya ang uban, labin, ayun pa nila nga, mas tsada daw ang kuhan kapag nakainom. Pero the real thing is, downers man na siya. So, ang later effect niya is, tulog jud ka.
Okay, from another question, unsay side effect sa mga energy capsules na intended to give extra power, can it cause cancer?
These are the kaning mga health-seeking behavior of Filipino.
Yes.
Of which they even ask for, kanabitang sa drug counter nga, gahimuon nilang pharmacist ang mga sales girl, no? And then they just ask, kung imong huna-hunaon, they are still chemical. So whenever you intake them, lagi na siya effect. So dili na siya mao nga no therapeutic. What's that? Side effects.
Okay. So sabi dito, tinuod ba nga kung dili maka-function or magamit ang lalaki, magka-prostate cancer siya, Dr. Greg?
Dili magamit.
No. But in patients with enlargement of the prostate, if there is irregular ejaculation, then the more it will be congested, the more the patient will have difficulty in voiding.
Paano yung mga monks at saka yung mga may vows of celibacy? Mataas ba yung kanilang prostate cancer rate?
Diba, they have something like this, what we call wet dreams. Sometimes they just ejaculate.
So another question. Ang dili, ito ang dili na mag-function sa gamit nga pang lalaki, pwede ba kini maulian? Unsay mga cases nga pwede pa o dili na?
Okay, ED.
ED. Pwede pa ba daw maulian? Ibig sabihin, will they recover from this?
It would depend on the cause of the ED.
No? So, kailangan magpa-check up.
Yes.
So don't be shy. Sige. My husband is a diabetic. No matter how he tried, dili gyud pwede. There are even times he rushes to do it but will just end up frustration for both of us. Are there ways for him to cope? Siguro unahon na to ang psych. Paano siya?
First and foremost, they have to refer that actually to the doctor, to their, kung kinsa iyang, and then talk about it, kay it could be because of the medication, and then para mas masabtan po nila kung unsa dapat ilang buhaton. Then after which you can do some counseling process para mas matabangan sila, especially the lifestyle, and sometimes nga sinasabi nila mayroon pa mga sex positioning.
Yes, and also siguro it's not really that kung baga there are also certain things na they can do to be able to satisfy each other, di ba? Laka tumawa na si Greg. Ito pa, please don't mention my number. My husband is a soldier. Every time he gets home na siya bag-o nga ibutang sa iyang reproductive organ, sometimes murag earring. I find it very unhealthy. Makadaot ba kini sa ako, Greg muna, sige.
It's more of sa males ang problem, especially if when they inject this petroleum jelly, which may cause fibrosis, and we don't know what would be the
long-term effect.
Long-term effect, yes. It probably could lead to malignancy or what because of the chronic irritation. So with the wife, it may just cause irritation or some inflammation of the vaginal
Which can
canal.
also cause cervical cancer later. Kasi studies have shown you know that constant irritation of that area can be aggravated.
Yes.
With
especially if these males have multiple partners.
Yes,
they may
that's
be harboring
true. So,
HPV.
kasama na lahat yun Okay? So, napadili pangutan, makakos ba og sexual dysfunction ag pag-contact nga dili pa ready ang partner kay mag-cause man kani og hapdo sa iya? Most likely this is a girl.
Yeah, of course. Bisan pa kana nga mga butang, it needs planning. Nga dapat prepared mong duha para if you really want to reach plateau nga ginaingon pa nila. So mas maayo nga inyo gid siyang prepared ka, ready mong duha, and then istoryahan ninyo.
And also siguro it's a matter of understanding your partner's needs.
Oo,
di ba? So it can go both ways, di ba? So there's another question here. Makakos ba og prostate cancer ang masturbation? Dr. Greg.
No, certainly will not.
Definitely hindi. So,
going back ba nga atong ginaingon nga dapat ready kay ato gina siyang tan-awon because the marital rape.
Yes,
that might happen after. So we should be kanang very sensitive towards each other's needs as spouses.
At saka para maging happy both, di ba? Hindi lang yung isa nagparaos ka lang. Kawawa naman. Napakabilis po ng oras ko dito sa Dynamic Living the Total You. Tapos na naman po ang aking isang oras. We'd like to thank my guests and also our viewers who interacted with us. So I'd like to start off by thanking Dr. Olive. Would you like to say something to our viewers?
Okay, I think the most important thing is that you have to be open to whatever needs, not just to, but most especially sa yung spouse, your partner, because at the end of the day, pinag-usapan nyo yun so you agree that you will get married and have this thing, so yun, talk about it and then refer to a doctor or a psychologist if it's necessary.
Okay, what about Dr. Greg?
Okay.
Gumamit ng ano?
Okay, for erectile dysfunction, if it's organic, then there can be treatment for that, like medications. If medication fails, then there's other options, like prosthesis, which we were not able to discuss. No? And there are also what we call these vacuum erectile devices too. So it would be best to consult a doctor because your ED or your dysfunction may be reversible.
At saka siguro para mag-guide siya kung ano yung best para sa kanya.
Yes.
Okay? So you know for a fact that sex is a God-given gift to married couples, that they should enjoy and have a very beautiful life together. Now, healthy lifestyle, open communication between partners can actually go a very, very long way. For the giver of love and life actually would want each one of us to be happy. So let us not forget to be able to talk to the right persons, to talk among yourselves also, and seek the necessary consultation to the right people instead of listening to what others has to say. This is Dr. Jean thanking you for another dynamic evening. Magandang gabi po sa inyong lahat.
Before you 7,107 islands to enjoy with 7,107 possibilities and more. We have just landed on the Ninoy Aquino International Airport. Maligayang pagdating sa Pilipinas.
Once considered as the tiger economy of Asia, the Philippines continues its slow yet steady climb to becoming an international business hub. Having been Christianized by her colonizers in the early 1500s, the Philippines now stands alone as the last bulwark of Christianity in this part of the world. Yet, she is not exempt from moral and social issues that beset nations big and small in this postmodern era. Yes, she needs Jesus now more than ever. Her 144 cities, with an average of 500,000 residents each, certainly need hope. An answered prayer, Hope Channel now covers the entire nation. Hope Channel media centers now stand in Luzon, Visayas, and Mindanao to bear testimony of Jesus' love. And in just a few years, many have rediscovered the beauty of life with hope.
Na-revive ko, pinagi sa pagtanaw na ko sa Hope Channel Philippines.
Malaki po ang magagawa ng Hope Channel para po sa pagtatapos ng gawain.
The good news that Hope Channel has brought to the archipelago has inspired a Filipino to see beauty and brought joy back in spite of it all. Sapphire seas and pristine coastlines, lush vegetation, gorgeous landscapes. With warm, fun-loving, and industrious people, the Philippines is paradise. Here is a fertile land for business, education, manpower, many other resources, and sharing the good news. Because the pearl of the Orient Seas now has the pearl of great price. The Philippines plus Hope Channel equals unlimited possibilities of sharing love, changing lives.